Did you know there are over 100 different known cancers? Welcome to the Inspired Vitality Show. I'm Catherine. Cancer is cancer, whether it's well-known or rare. If one of my loved ones was diagnosed with a rare cancer, I would want to be able to find information about it. So in this video, I'm going to cover the rare gallbladder and bile duct cancers, but I'm also going to give you 5 key cancer awareness tips. So stick with me to the end. This is important information. The gallbladder and bile ducts are part of the digestive system. The gallbladder is a small, pear-shaped pouch that lies beneath the liver in the upper abdomen. It stores bile. This fluid produced by the liver helps digest fat. The gallbladder releases bile into the small intestine through the bile duct. The ducts are a network of tubes connecting the liver, gallbladder, and small intestine. Their major job is to move the bile from the liver and gallbladder into the small intestine, where it helps digest the fats in food. Cancer develops when abnormal cells in these structures multiply and grow rapidly. You can develop cancer in either the gallbladder, the bile ducts, or both. Only about 1 of 5 gallbladder cancers is found early. Bile duct cancer is more rare than gallbladder cancer and can affect any of the ducts or tubes that connect the liver, gallbladder, and small intestine. These cancers are often grouped together and share February as their awareness month. So what are the risk factors? When we talk about risk factors for cancer in general, remember, anything that increases your risk of getting a disease is called a risk factor. Having a risk factor does not mean that you will get cancer. On the flip side, not having risk factors doesn't mean that you will not get cancer. For gallbladder and bile duct cancers, risk factors include chronic inflammation, obesity, alcohol, and gallstones. Having colitis or certain liver diseases can increase the risk of bile duct cancer. So moving on to symptoms. Early on, gallbladder and bile duct cancers may cause no symptoms, nor can they be seen or felt during a routine physical exam. Rather, many of them are found when the gallbladder is removed as a treatment for gallstones. For this reason, gallbladder cancer can be challenging to diagnose in its early stages. Symptoms are typically not present until the disease has progressed, and when symptoms do appear, they can include yellowing of the skin and whites of the eyes, which is jaundice, abdominal pain or lumps in the abdomen, fever that won't go away, nausea and vomiting, unexplained weight loss, or bloating. Jaundice is the most common symptom of bile duct cancer, and nearly half of all people with gallbladder cancer have jaundice when they are diagnosed. The yellowing of the skin and whites of the eyes happens when the liver cannot get rid of bile. Although many people with gallbladder and bile duct cancers have jaundice, the most common causes of jaundice are hepatitis and cirrhosis, not cancer. Having a gallstone lodged in the bile duct can also cause jaundice. It can prevent bile from flowing into the small intestine. This is a non-cancerous condition. If you should need to have a gallbladder removed for any reason, remember that you can live without it. The gallbladder helps to digest food, but you don't need it to live. When it comes to diagnosis, if a patient goes to their doctor with any of these symptoms, the doctor will do a physical exam and health history and likely blood work, such as a liver function test. Blood work tests cannot determine why levels of these substances are elevated. To do that, your doctor may order one of the following tests: ultrasound, CT, MRI, or endoscopy. Endoscopy is a flexible tube that is passed down the throat, through the esophagus and stomach, and into the common bile duct. So treatment for gallbladder and bile duct cancer may include any combination of surgery, chemotherapy, radiation, targeted therapy, immunotherapy, or palliative therapy. Now to the big takeaway. Cancer is sneaky and can present itself in ways that can easily be explained away and can be related to non-cancerous diseases. This is why it's important to, number one, know your potential signs. That's why I'm here doing these videos. Know what's normal for your body is number two. Number three, make note of changes and persistent symptoms. Write them down. 4, talk with your doctor if you are experiencing changes and persistent symptoms. And number 5, be a strong advocate for yourself. If you feel instinctively that something is wrong and you're not getting answers, don't be shy about getting a second opinion. Remember, cancer is cancer, common or rare. It's important to know potential signs and talk with your doctor about persistent symptoms. In this video, I hope I have been helpful. If so, please give me a like or leave a comment. See you soon.